My talk is quite simple. It's called The Perils of Plasticity. You've all heard me, I think at least half of you, talk 10 times about defenses. This is a chapter George Williams did not want in the book, but it turns out to be very relevant for clinicians because what we see in the clinic is much more, you can't hear me, is much more defenses than diseases. In particular, you've seen this slide, many of you before. A lot of problems are direct diseases, seizures, cancer, paralysis, and that kind of thing. But most problems people bring are, in fact, defenses. Things shaped by natural selection to be expressed in those situations when they're useful. And of course, the question is, when are they useful? How should natural selection shape the system that regulates the expression of a defense? Which should be very simple, of course. You should express it whenever the cost of the defense is less than the cost of the harm, because you'll get benefit. However, you don't always know whether the harm is present or not. So what if the cue is unreliable? And my favorite example, of course, is you go to a watering hole and you hear a small noise behind a rock, and the noise is something like this. Grr. It's not grr. It's not grr. It's just grr. And you don't know whether you need to run like hell or whether you can relax and get the water for your family. In that case, you should express the defense whenever the cost of the defense, say running away, is less than the probability of harm times the proportion of reduction of harm. I'm sorry, this is old hat to many of you. This is basically where the smoke detector principle came from. How loud does the noise have to be before it's wise for you to flee? And in the standard example, the cost of fleeing is 200 calories. The cost of not fleeing, if there's a lion there, is 200,000 calories. And I struggled with this for a month, actually, trying to do the calculation. It's not that hard a calculation, but I couldn't believe the result because this means it's optimal to flee whenever the noise is loud enough to make it more than 1 in 1,000 chance that the lion is there. And I was treating anxiety patients at the time, and this implied that 999 panic attacks out of 1,000 are perfectly normal, but utterly unnecessary in that particular instance. And this is, of course, the smoke detector principle, signal detection analysis of defenses. There's some fancy math that goes behind doing this properly. But essentially, false alarms are normal and common, not just for anxiety, but for all bodily defenses that are inexpensive, fever, cough, nausea, and all the rest. This is profoundly important in the clinic. Doctors should understand what they're doing when they use drugs that block normal defenses. This is why we can safely block those defenses, what primary care is half of the time, and why we have to be careful, because there's still that 1 in 1,000 chance. That's the smoke detector principle. Now this is old hat, but I'll point out what other people have pointed out to me, and I've gradually come to understand this does not explain anxiety disorders. It only explains normal anxiety. I'd like now to move on to another question. Why are we vulnerable to panic disorder? And this is a case I keep talking about how clinicians have things to offer evolutionary biologists as well as vice versa. And I realize I have real data. I'm so envious of those of you who have these fabulous data sets. But I have seen probably 5,000 patients with panic disorder and talked with each of them for an hour or 2 or 3. And it gives you real information. What I learned from those folks, first of all, panic disorder. That's what causes panic. That's a grocery store. And there's nothing dangerous there. This is real useless anxiety. And it happens over and over again. This is my conclusion from years of seeing patients with panic disorder. Almost always, what's going on is a positive feedback process where the symptoms themselves cause fear that the person's having a heart attack, a stroke, or a brain tumor. And because that fear arouses more symptoms, causing more fear of symptoms, it cycles around into a spiral that gets people all the way up into panic disorder. Many of my patients were afraid to mow the lawn because it might make their heart rate go up a little bit. And then they would worry they were having a panic attack, and that would cause fear, which would cause an actual panic attack. And it just keeps getting worse and worse until they're having 2 or 3 such attacks a day, and they really need psychiatric treatment. It's a very common, very serious problem that keeps people from even leaving their house for weeks at a time. This led me to think more deeply about diseases in general. And I realized how many diseases are at their root based on positive feedback of some sort or another. What happens in appendicitis? A little bit of inflammation at the neck of the appendix compresses the blood supply. Once that blood supply is compressed a little bit, inflammation can get larger because the bacteria can grow, and before you know it, the blood supply is turned off entirely and the appendix bursts. What's a heart attack? Well, it's a tiny bit of clot coming on a bit of an atherosclerotic plaque, which increases turbulence, which increases clotting, which increases turbulence more, and what you get is a small thing suddenly become a big thing. Cytokine storm, some kind of inflammation causes tissue damage, which causes more inflammation, causing shock and cytokine storm. Protein folding disorders. You get some proteins misfolded and they induce further abnormal folding for the next ones. Obesity. You get to a certain level of weight, you can't exercise anymore and everything hurts. Then what? You get heavier and heavier and heavier. Impotence is a really obvious one, I'm afraid. What's the most common cause of impotence? Guys worried because they're afraid they might become impotent. And then there's heart failure. Again, a dramatic example in that a lot of heart failure was caused by increased fluid volume, pushing the heart beyond its Starling optimum. And once the heart gets to that point, it starts pumping less. And what do the kidneys do in that circumstance? They absorb more water, making it worse, leading to sudden escalation of a heart failure. Really a dumb design, except it's not designed for heart failure, it's designed for dehydration in a natural environment. All of these examples that made me think we really should be thinking about the functional significance of regulatory systems in trying to understand disease. We'd heard earlier about what is disease. I'd like to suggest that most diseases we deal with are failures of regulation systems. And we should be thinking at this level of causation, not just about G or E and G by E. We should be thinking about failures of regulatory systems, which led me to go back to two books I read at the beginning of my career. I recently reread Cybernetics. There's a fabulous chapter in there about evolution and mental disorders and general systems theory, which when I read it the first time, I thought it was me that I couldn't get that much out of it. But so everybody talks in medical school and elsewhere biology about homeostasis. Very, very nice. We do need to understand that. But are most biological systems there to keep things stable? That's a very small part of the story, actually. The more modern way is to talk about allostasis and rheostasis, which adjust things to different circumstances, and people argue about what those are. We as evolutionary biologists have, I think, a broader perspective on these things. We recognize that it's not just homeostasis, allostasis, and rheostasis, it's adjusting for changing circumstances. What we're talking about is adaptive plasticity. Natural selection has shaped all kinds of systems to adapt bodies to different circumstances. Thousands of regulatory mechanisms, really tens of thousands, to adjust to the body to different circumstances. I think we should not try to separate these out differently. Across all time frames, from seconds to lifetimes and multiple generations, in seconds we have heart rate variation and blinking. In minutes, we sweat or we don't. In hours, there's inflammation, comes and goes. In days, there's tissue repair. In weeks, there's tanning. Years, there's setting the stress point. Over generations, the predictive adaptive response. All of these are regulatory mechanisms shaped by natural selection to adjust our bodies in ways that maximize fitness. Classic example is Terry Lee's voles. Those born in the summer have longer fur. Makes no sense. Except it does, of course. They're monitoring day length. They've got a system that makes their fur grow longer when day lengths are shortening because natural selection has given advantage to those that have longer fur in winter. Lovely work by Talleyrand and Harrell on water fleas. Essentially, they grow helmets whenever there's a predator present, but otherwise they don't. Fabulous example. And this is my work on emotions. What are emotions? Emotions are facultative adaptations, plastic responses that adjust many aspects of the behavioral system to cope with the current circumstances. Now, this is a control system diagram that I used in the paper on the smoke detector principle. It's just adapted from many others. There's a lot of things in there, but this is how we adjust our regulatory systems. There's a lot that can go wrong there. But this isn't how it really looks. This is an idealized mathematical kind of model. It's like, I took out some slides for time. So anyway, the question I'd like to ask now is, are there some systems that are intrinsically vulnerable to dysregulation? My classic question about why aren't bodies better? And here's my answer. Systems that up-adjust reaction norms, that is, systems that become more sensitive with repeated arousal, are especially vulnerable. Whenever repeated arousal decreases the response threshold or increases the gain, it's vulnerable to positive feedback. This led me to reading about positive feedback. It seems like it's bad stuff, right? Because it leads to dysregulation. Absolutely not. I mean, if you start looking at cell physiological regulation, there are all these examples in which positive feedback is essential. It's essential for making bistable switches, which switch meiosis and spore formation on and off, enzyme induction anticipation. Did you know that E. coli can learn to metabolize galactose, and the second time it's presented, they do it faster? Really incredible. Cycles and rhythms, stabilizing systems. Positive feedback is essential to making networks effective. Why would repeated arousal increase sensitivity? Because basically, if you're repeatedly arousing a defense, it means you're doing something wrong and getting yourself into trouble over again. It's wise in that circumstance to arouse that defense more quickly and more strongly. You get a net benefit. Again, the positive feedback cycle that we're at risk of in these systems is when the cue causes defensive arousal, and repeated arousal makes the lower threshold lower, you're at risk of positive feedback. Panic we talked about before. In fact, for my patients, repeated near escapes or panic attacks themselves, they push the threshold down so a tiny thing sets off a panic attack, which makes really great sense if, in fact, you're facing real danger. Chronic pain. John Durrell talked yesterday, and his poster was lovely, showing a repeated stimulation of the pain system downregulates the pain threshold. More pain, and this is probably the key to chronic pain from an evolutionary regulatory viewpoint, not just from a viewpoint of proximate mechanisms. Substance abuse is a very easy one, isn't it? It's kind of external, but you get going in that pathway, the more you go. Eating disorders. Here's a really easy way to get an eating disorder. Try dieting, not eating everything for a few days. You will then binge, because that's what people do. And when you binge, you're going to get terrified and try harder. And your weight set point will go up a little bit for other good reasons. Bad positive feedback cycle. Kindling and depression. First episodes of depression, 80% are precipitated. Fourth and fifth episode, hardly ever. Makes possible sense, according to what we just heard from Fraser, actually. I think his model is appropriate for depression. Repeated disappointment and wasted effort lead you to quit trying. So, evolutionary explanations for all of this. Notice I've just been telling you how this system works at a physiological cybernetic level. So what's wrong with this? What's going on here, really? It's partly trade-offs. These are 3 of my 6 main explanations. And partly constraints that limit options, and partly mismatch, but that's a longer lecture. So my specific conclusions are that systems that up-adjust reaction norms or decrease thresholds are especially vulnerable to runaway positive feedback. My general conclusion is there's a whole world to be explored here in complex systems at the intersection between cybernetics and evolutionary medicine, where we can analyze systems and their failures in terms of their functional regulatory networks instead of just their mechanisms. Thank you very much.
Thank you, Randy, and we do have time for at least one question.
Hi, Randy. Brilliant, as always. Here's the question. Based on everything you've just told us, how can you use this knowledge of plasticity tangibly when you're treating patients?
Well, I don't think that's the right question. I want to figure out how it works first. I think you can. I mean, I tell my patients it's positive feedback they're trapped in, and that helps them actually quite a lot in the clinic. So I do have an easy answer to the panic question. But I think the deeper question I haven't addressed here is, why don't these systems go into positive feedback loops all the time? And I think there's probably a whole world to be explored about really subtle mechanisms that natural selection is shaped to push these things right to the edge and ensure that they don't go in. I mean, this is what engineers do constantly when they're designing stereos and servo mechanisms for airplanes. They want to push them so that they're very sensitive and stable, but they don't go into positive feedback. And I think if we connected some engineers who know that kind of area, and guys like this fellow sitting right there, we would be able to make progress.
Sorry. I think we need to end now and take a break, but Randy and everybody else will be available for questions now. And thanks to all the participants.